As someone that has struggled with anxiety disorder for 7 years of my life, thankfully not anymore, I have always wondered why there's no video on YouTube that goes through a ton of options for therapy for anxiety, like what therapy types there are that are able to help with anxiety, or for things where anxiety is the secondary issue, like PTSD or ADHD or OCD technically is also a form of anxiety. So I will make this video myself because there's quite a lot of different therapy types that a lot of people might not know that I had to look for myself for ages, and some of them I didn't even know until after I stopped having anxiety disorder on like a clinically relevant level. So I want to share that with other people because I know what a struggle it is. I want to note one thing ahead of time, which is if you research these therapy types, I recommend not researching them through Wikipedia or ChatGPT. Obviously, don't use that for research in that kind of sense. But like a lot of Wikipedia articles about therapy types are very biased one way or the other, and it's just really weird. So like, yes, look up the pros and cons, but keep in mind that like sometimes the criticism is blown a little bit out of proportion. The first therapy type that is usually recommended for anxiety disorder is cognitive behavioral therapy, or CBT, which is a form of talk therapy. It's very like problem focused, action focused, and it's trying to like essentially change your responses to things and your mindset about things. I mean, I'm explaining it very vaguely, but it's like the most normally available therapy type. Personally, I have done that type of therapy for 2 years while I had anxiety disorder, and I do think it's helpful to a certain degree. It makes you more functional in society, but I don't think it really gets to the root of the issue of anxiety disorder. But like if this is the only therapy that's available in your area and you haven't tried it yet, obviously try it because it will probably help at least make life more functional for you if anxiety is very debilitating for you, like it was for me at some points. I do think it's smart to do cognitive behavioral therapy for like a year or two and then build other stuff on top of it, like some of the things that I will mention in this video. I do want to note that CBT is called the golden standard of therapy. Everything else is usually compared against this type of therapy in research, but that doesn't mean that this type of therapy is without fault. There is a lot of criticism around it, and it is kind of a well-known conversation topic among neurodivergent people that this type of therapy doesn't work as well with neurodivergent people. Like, it does work with the basics of CBT, so those basics can be very helpful even for someone with ADHD, for example, but like the core of CBT can be very unhelpful to people with autism, people with ADHD, you name it. I do also want to mention there are specialized forms of CBT for grief, for example, or for suicidal ideation. It is just more rare to find someone certified in those, but if you have someone around you, like in your area, that is certified more specifically in CBT, that's usually a good indicator that they're a decent therapist, because most people go into learning CBT first, which is good and also bad because it's harder to find a good therapist that does this type of therapy, because a lot of the more shitty therapists also learn this first, if that makes sense. Like, if everyone learns it first, that means also the shitty therapists learn this first. I feel like a good sign for a good therapist is that they have more than one certification. So like, they don't just do one type of therapy, but they learn at least 2 different types of therapy or 3 different types of therapy and have the certification for that somewhere, ideally online. But let's move on to the second type of therapy that I think is actually pretty good, which is acceptance and commitment therapy, which is technically a subform of CBT. This type of therapy is more about observing and naming emotions and contexts and thoughts, which gets us like a step closer to more somatic, like body-focused therapy types. A lot of programs made for anxiety include parts of ACT or ACT in their approach, because with anxiety, our nervous system is so overwhelmed in a sense that it can be helpful to start like noticing specific things again first. I do personally think ACT has to be combined with other things for it to be very helpful, but it is, in my opinion, definitely a better start than CBT. because CBT is more about like fixing a symptom, and ACT or ACT is more about self-compassioning yourself through anxiety disorder. That's the way I would describe it. It has definitely helped me with anxiety attacks. I find it a little bit harder to use for panic attacks, but for people with anxiety attacks, this can be really helpful. Acceptance and commitment therapy is often combined with ERP, which is exposure and response prevention therapy, which is essentially like putting yourself into situations that trigger you slowly. One thing that comes to mind where both of those therapy types are combined is several books for anxiety, of course, but specifically the Dare book and the app that belongs to the book, which I recommend if you're like having a lot of issues doing like public transport or stuff like that, because it can be really helpful to have that app. I do have my problems with the full Dare idea, Dare response, whatever, but it can be really helpful. Like each thing that I'm naming has its own faults. Not every therapy type is for every person. So obviously each therapy type has its faults. ERP is obviously about like putting yourself closer and closer to something that triggers you, or repeatedly putting yourself into a situation that normally triggers you while trying to maintain the feeling of safety. Obviously, sometimes it needs to start first, that you cultivate safety first, and then imagine yourself in a triggering situation, and then do tiny steps. But some other things are like about flooding, so like you're being thrown into the situation. That's not as common, but it does happen sometimes. I mean, for some triggers, you can't really do much more than flooding. I do think this can be really unsafe for people with PTSD, and specifically complex PTSD, because not a lot of therapists are specialized in this. And when you have PTSD and CPTSD, the first thing you need is like an inner sense of safety again, and a lot of therapists are not really good at building that in like individuals with CPTSD specifically. And as you probably know, CPTSD has a secondary issue of anxiety, because PTSD is a form of anxiety disorder as well. So CPTSD and PTSD obviously also fall under the umbrella of all the anxieties covered in this video. But this is a therapy type that's used for OCD a lot, and everyone with OCD probably knows this type of therapy, because if you have the diagnosis, it was probably offered to you at some point. ERP is often combined with CBT because they're kind of sisters. I do think doing ERP to yourself can be really helpful. So putting yourself slowly into triggering experiences. Obviously, it depends on what type of anxiety you have. I had agoraphobia, so for me it was like going on walks that are further away and further away each time. So if you have anxiety that can be gradually worked with, then exposing yourself to that trigger yourself is also a thing you can do. For other people, it might be a good idea to expose yourself in an imaginary way through meditation, and then visualizing, if you can visualize. Not everyone can visualize, but if you can visualize, you should maybe try that, visualizing triggering experiences in a meditation, like after already calming yourself down. And then, how would you work through it? Obviously, there is stuff that is so triggering. You know yourself best. If there's something that is so triggering that it will re-traumatize you unless you work with someone specialized, don't try to expose yourself to that trigger. I'm not approved to be a therapist yet. Always take things on the internet with a grain of salt. Obviously, I cannot tell everyone to be like, oh, expose yourself to like your triggers. No, that's not safe for everyone. Obviously, that's always a side note for any therapy type that I'm naming, where I say you can do this in a small way to yourself at home without a therapist. That is true for most therapies, but obviously everyone is different, and if stuff could make you feel worse after the fact, don't do it. The next therapy type / technique is emotional freedom technique, which is tapping, which you probably have seen people do before, like tapping on different parts of their like face. It is by Wikipedia still called a pseudoscience, but there is actually a lot of research that has come out in the last 4 to 5 years all across the planet. There is a channel of a person that does research on this. She does a yearly roundup of all the research that was done on emotional freedom technique, or EFT, or tapping. Her name is Peta Stapleton. I can link her stuff below. It's really interesting looking into like what kind of research has been done on this, because obviously we're not quite there with being like, oh yeah, this is like proven, blah, 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 because we don't know the mechanism that makes tapping work well for people. The theory, as far as I know right now, is about that it's combining the mind and the body, like somatically. The problem most people have with it is that it's coming from energy psychology, which is based in Eastern medicine. So, like, the tapping points are points where meridians are, like energy centers and stuff like that. So where like you would usually get acupuncture in those places and stuff like that, which ironically we have also research on acupuncture and that it works, so there must be something to it. It's almost like indigenous people were always kind of a little bit right. But yeah, EFT can be done alone. I highly suggest you to look up how it can be done alone. There are apps for it, there are videos online. You can look up what kind of questions a therapist, like a practitioner, would ask to get to the ground of something. I wouldn't use this on your big trigger, obviously. For that, I obviously would recommend working with a practitioner. And yeah, there's no one governing body for the certification, as far as I remember, but there's like one big certifying body, which is I think called EFT International. So look into that and how they need to be certified, and if you think that's like a good certification. Like you don't need to have a degree to understand how much training someone should have had to be a good practitioner of something, and I think they have probably the best certification process. So like if a fucking practitioner has that one, like that certificate, probably decent chance they're not completely bad. But obviously there's also people specialized in anxiety disorders and PTSD and whatever, so take your time researching this one. Anything that doesn't have like an official governing body, that like the one way of doing it, like with some of the other things I will mention as well, always do extra research and research for a longer time than you usually would, because obviously there's easier loopholes for people to scam people and not be good at what they're doing. I personally use EFT tapping in like day-to-day life, and I do think it is really helpful for anxiety attacks and when you're like having sensory overwhelm, especially when you have sensory overwhelm. If your anxiety comes from autism or ADHD, sensory processing issues, tapping can be really helpful in my opinion, because it helps you regulate your nervous system. Highly recommend. But yeah, like look into that if you haven't tried it yet for like anxiety. Highly recommend, and look into if you would want to work with a practitioner, because that's not the worst idea. The next one is also one that doesn't have nearly enough research on it, and it should have more research, because we have a little bit. We have research for it in some ways, but not in others. The next thing is hypnotherapy. So hypnosis, regression hypnosis, and also like there's several types of hypnosis. That's a thing you should probably look into. It is kind of what it sounds like, but also not what you think it is. Like it's not show hypnosis, you know, where people hypnotize others to do weird shit. Hypnotherapy is more meditative and relaxing and not about doing weird stuff. It's weird to figure out which part of hypnosis is like medically backed and which one isn't, because it is medically backed that hypnosis helps with pain regulation. That is that is researched, but we don't fully know why. Like there's like some parts that are like neurotransmitters and we know that, but like there's obviously the claim that hypnosis makes your like subconscious more open to suggestions and whatnot. So you know, it sounds woo-woo, but I wouldn't put it in this video if it didn't help me. Everything that doesn't have a lot of research that I'm putting in this video is stuff that I myself have tried, and hypnosis is actually the reason why I don't have anxiety disorder anymore. I researched different practitioners and different certifications for literally 3 months and then picked a hypnotherapist that I wanted to work with, and I had one really long session, and since then I didn't have, I mean, my issues are still like at like a 2 out of 10 sometimes, and I have a bad phase in life, but it's not, I'm not struggling anymore, you know, with anxiety disorder. So it definitely helped me. But I also have to say I went to 2 other practitioners since then to get hypnosis for like smaller things, and I can definitely tell a difference in quality. So there's like no universal certification because there are so many types of hypnotherapy as well. So I highly recommend doing a lot of research, and I highly recommend specifically hypnoanalysis, which is a form of regression hypnosis, which there is a lot of like, oh my god, they can implant wrong memories into your brain. Maybe I should do an entire video about this, because valid fear, but usually that's not what a good hypnotherapists would do, obviously. So obviously also look in the reviews. There's always people who are like, that are like, oh, this didn't work for me. Like, yeah, obviously not every therapy type works for everyone. Anyway, this one helped me though. And after I struggled for years and years and went back into a loop, like it got better, I got worse, I got better, I got worse, and then I got hypnotherapy. So that's why I'm putting that in here. There is research on it that's being done in Germany, as far as I remember, on depression. We have that, but we need so much more for anxiety, because that's a thing that it's supposed to be very helpful for, but we don't have like the proof that it's like a valid treatment option, you know? There is also a type of hypnosis that's more about like affirmation stuff, like where you get put into a meditative hypnotic state, and then affirmations about your issue are getting like repeated to you, and that's usually over several sessions. And I'm pretty sure that's not as helpful as regression hypnosis, but honestly, you can try either. It's not unhelpful either way. Hypnosis helps your nervous system realize what actual relaxation feels like, which a lot of people with anxiety aren't really used to anymore. So hypnosis is kind of a treat to yourself either way. Sometimes an expensive treat though. Then the next thing I'm mentioning is not a type of therapy, but it kind of is. I mean, in a societal way, it's kind of being called one, which is working out, but like with a personal trainer, which, believe it or not, personal trainer also kind of the same kind of expense area as a therapist. Of course, you don't need a personal trainer if you have like the kind of brain that can just get into a habit of working out. But I think we all know that working out has positive effects. A good personal trainer, though, can figure out which kind of exercise is proven to help with anxiety, because as far as I could tell, and I can link that below as well, if I can find it again. Let me read this. The effects of acute physical exercise and anxiety symptoms are greater in individuals with higher anxiety states. So if you have really high anxiety, working out will help you more. But also, I don't know if I copied this out from the study that I read, but mid-range exercise, aerobic exercise, is better for anxiety than like high intensity stuff. There's like research on that too. Like, I'm gonna link the meta-analysis of aerobic exercise for anxiety below, because yeah, girl did some research. So yeah, of course, if you can get into that habit yourself, do that. But I know a lot of people have struggles with that, so it might be a good idea to invest in a personal trainer. There's also personal trainer apps that's a little bit cheaper, but it might help you stay accountable, because it is helpful. I mean, as much as it's annoying to hear, it is helpful, because a lot of people that have anxiety disorder don't move enough. So there's just like adrenaline in your body that's like too much cortisol. I'm not a biologist. I don't know exactly like, oh my god, this is how cortisol works and this is how but I think we both know what it's like to have too much of that in your body. For me, it turned into TMJ, so like I'm like biting my teeth when I sleep, because I have too much energy built up that I didn't work off during the day. So there's several positives. But if you have depression together with anxiety, I know this can be really difficult. So working with someone specialized in working with people that have depression or have anxiety or have both, obviously usually better, because they know how to work with it and can give you the compassion that you might not be giving to yourself. The next one is Dialectical behavior therapy, also called DBT, which is also a sister of CBT. It was initially created for borderline personality disorder, but it's also nowadays used for like very deep depression, suicidal ideation, bipolar, like mood disorders in general. And it has 4 pillars: mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness, which I like that it has like a pillar structure to it, because it's satisfying to my brain. A lot of people with autism have said in recent years and recent months that this has helped them as well to like cope with the world. So like if your anxiety comes from autism, that might be helpful. A big core of DBT is skills and tools that it teaches you. A lot of conversation in therapy is about building a toolkit, building skills, and it's never like really explained what it is, and DBT does explain it. For example, there's like the tip skill, TIPP, which I have to go look down and read, which is used for high levels of overwhelm, and TIP stands for temperature, intense exercise, paced breathing, or progressive muscle relaxation. So like TIP skills are essentially like, oh, if I'm overwhelmed, here's like 4 things to choose from. And anyone that has overwhelm in their life knows having some options to choose from reduces the overwhelm of what to do next. So this is just one of the skills. There's other skills and acronyms and all that. Like there is a website that's just called Dialectical Behavior Therapy. I can link that below as well. And they explain literally everything about their, like the skills on there. So that's a good start if you don't have a DBT therapist nearby, or like if you just want to get started with implementing stuff into your life. Highly recommend. The next therapy type is somatic experiencing, and just more broadly somatic therapy. Somatic experiencing comes from specifically the book Healing Trauma by, I think, Peter Levine is his name, but somatic therapies in general. I'm lumping all of them in one here. They're usually used for PTSD, but a lot of anxiety secretly comes from trauma. Mine came from trauma, so you know, and also partially from ADHD. So, you know, it really depends. If you think your anxiety comes from like something, like from one like thing, and not just from something you've developed over time, usually a good idea to get a little bit into somatic work by yourself and with a practitioner. It's just really hard to find a somatic practitioner in some places in the world, even in the Western world. I mean, I live in Germany, and finding a somatic practitioner where I live is... let's not talk about it. Somatic experiencing specifically, but also all somatic therapies kind of are about like interoception. So like noticing how you feel, where you feel it, yeah, and what that feeling makes you feel, and where you feel that. So it's like, it's kind of like chasing a feeling without, like, it's not obviously not chasing. It's like the therapy kind of teaches you to feel your feelings, which can be difficult if you have anxiety disorder. I would know. I want to note that this is called an alternative therapy. That means there's not enough research on it, but a lot of people, anecdotally obviously, because it's not researched enough, are saying this is really helpful to them, especially for PTSD stuff. The problem with this therapy is usually it's not offered by therapists that are covered by healthcare, and it's a type of therapy that takes months to years to show results, like long term. It's technically a therapy that teaches you, if you have a really traumatized nervous system, to have a more healthy nervous system again that doesn't get easily dysregulated. So like that obviously can't be done in a week or even a month or 2 or 3. So it is a therapy that takes a long time, which is a little bit shit if you have to pay for it yourself. So I have to give that heads up. But there are a lot of like somatic frameworks that are shared on YouTube if you like do a deep dive. And obviously, at some point I'm gonna make a video about how to feel your feelings, which I'm also not the best at because I'm neurodivergent. If you're neurodivergent, you're usually permanently dysregulated. So, you know, I feel you. The next therapy type is really interesting, and I think it's more for the neurotypicals, which is Schema Therapy. It's usually used for personality disorders, but has also been used for like depression, anxiety, the typical ones, you know. It's usually second line therapy, which means, I mean, first line treatment, for example, is cognitive behavioral therapy for most things, and if that doesn't work, this is like more of a second choice. This is also used in eating disorders, for example. If something else didn't work, this is something that is sometimes used. It is a cognitive psychology thing. It is a form of talk therapy, and it is very similar to psychoanalysis in a way, because schemas specifically refer to like early maladaptive views on the world and behaviors and that came from it, and mindset stuff that comes like from trauma as a child, for example. It is very psychoanalysis based, which is why I personally think it can help a neurotypical person more than a neurodivergent person. So if you have anxiety but not much else, this is probably gonna work better for you than someone that has anxiety because they have ADHD. But I don't ever want to count that out. There's always a kind of person that's neurodivergent where the typical neurotypical stuff helps a lot. I never want to count someone out. It's just, to me, it sounds like a therapy that the basics make a lot of sense to me, but like psychoanalysis doesn't make sense to a brain that wants everything to make sense, and psychoanalysis sometimes it's not good at making sense. It's also very talk therapy based. Obviously, talk therapy doesn't work for everyone. I do think you should try it at least once, or honestly twice, but it doesn't work for everyone, or it works only so far for most people. I do not want to talk down on this therapy though, because I do think it can be really helpful. Like I said, initially it was made for personality disorders, and it can help with eating disorder, which means it can probably also help with PTSD and anxiety. I just think it's a second-line treatment. Like I said, it makes sense that it's a second-line treatment. Look into it, see if it makes sense for you if you're like a neurodivergent person, which you are if you have CPTSD, ADHD, autism, most things that have anxiety as a secondary symptom. But if you're neurotypical, you could probably get on board with this pretty fast. If you're neurodivergent, it might take a little while to read into the type of therapy to be like, this sounds like something that could be useful for me. And others will be like, I don't know, this seems too Freudian. The next one is also one that everyone will have a different opinion on after looking into it, which is attachment-based theory. Also very psychoanalytical. I have my opinions on psychoanalysis, obviously, if you couldn't tell. It can be helpful to a degree, but only to a degree, in my opinion. Psychoanalysis looks at the root of beliefs that you formed or behaviors that you formed in your childhood, usually. And if you know what attachment theory is, I highly recommend looking up the basics of it. Attachment theory basically states that in the early stages of building attachment as a child, as a baby, as a child, whatever, you get like the baseline of how you interact with the world, like with other people, like the attachment style of being more anxious around other people or more avoidant around other people, or in a relationship at the very least. And this type of therapy combines kind of psychoanalysis with attachment theory. There is not that much out there that explains this pretty well, so I might be doing a bad job. But if you have someone in your area that does this kind of therapy, definitely ask them a lot about it, because it can be really helpful if you have a lot of trauma, but only if you work well with psychoanalysis. Some people work really well with psychoanalysis if the practitioner is good, which I feel like is the most important part of therapy either way, but especially when it's about psychoanalysis, because it's someone digging into your past and then making assumptions about it technically. The next therapy type is internal family systems therapy. IFS for short. It's an integrative type of therapy. There's like with every therapy type that isn't deeply researched, there's always oh my god, there's controversy and criticism, but a lot of people anecdotally again say that it helps them, and I do think it is a really good approach for a lot of issues. I do think it makes a lot of sense, for example, if you have any history with suicidal ideation, to work with IFS or with parts therapy in general, because being able to like externalize some experiences that you have can be healthy, right? So for example, if you're suicidal, seeing your suicidality as a part of yourself but not as yourself can be really helpful. Same thing with assumptions about yourself. Sometimes we think I'm not enough, you think that way, but parts therapy or just externalizing would be, I have a part that feels like I'm not whatever, so like you can put like a little extra, like, not barrier in between, but it helps put things into perspective. IFS is very intuition based, so if you don't feel like you have a good intuition, that might not be the best therapy for you, because you kind of just go off of vibes in a sense. I don't know how to explain that. I do think it works better for people with good imaginations, which not everyone has a good imagination. Some people have aphantasia or no inner monologue, and for those people I wouldn't recommend this. But if you have ADHD, if you have autism even, depending on how intuitive that you are, because I know a lot of people with autism also have aphantasia, which is interesting. It really depends. I do think this can help with anxiety a lot and with PTSD, because I feel like people with PTSD often have very imaginative minds, which there's an explanation for that. I'm not gonna go into that now, but there's an explanation for that. I would obviously not recommend this one for people with a history of psychosis or any type of medical level delusion or schizophrenia. Same thing, by the way, with hypnosis, but I feel like that's kind of self-explanatory. I fear. Don't do stuff that could trigger psychosis if you have a history of psychosis. IFS is super interesting, has a very basic core way of how it works. You can look that up as well. I feel like most websites explain it pretty well. There's 3 types of parts more or less, like roles for parts essentially. And then there's like a concept of like the self, and then oh yeah, it's hard to explain this without having a dedicated video to it, but I can see if I can find the video again that explained it pretty well, in my opinion. If not, I'll find a website that explains it and link it. The next therapy type is EMDR, also called, I have to read this one, eye movement, desensitization, and reprocessing. I feel like a lot of people know what EMDR is at this point. Most people know it as like following like a light back and forth, like left to right, like bilateral stimulation. It can also be done with like stuff you hold in your hands that go back and forth. There has been very inconclusive research about it. This is like a therapy type that's called like a purple hat, I think theory is what they are called, where the functional, effective part of a therapy is able to be explained through one part of the therapy and another part was simply added. In this case, it would be the bilateral stimulation, which I think means people that criticize EMDR think that the imaginary exposing to the trigger is doing the main work and the bilateral stimulation isn't doing the main work. But we don't have a lot of extra research on like figuring that out yet. So a lot of people say it has helped them a lot for trauma and specific anxiety types. I mean, obviously not everyone has like generalized anxiety or social anxiety. Some people have like very specific types of anxiety that debilitate them. I feel like people that say this worked for them generally have like more specific phobias, but it can also probably help people with generalized anxiety if nothing else helped them. I don't know if it's good for social anxiety. I feel like social anxiety is the best when it's done with EFT, hypnosis, and ERP, and acceptance and commitment therapy, obviously. But I feel like EMDR helps people with PTSD the most, and anxiety that is similar to PTSD, so, you know, specific trigger. The good thing about EMDR is a lot of therapists that are covered by healthcare companies do cover it, so look for that. So like that's like one that might be easier to try out for you because more people are trained in it casually and they're covered by your healthcare company, so like your insurance. So yeah, that's a plus point for EMDR for sure. The last few ones I will try to work through a little bit faster because they're more like small tips. The next one would be neurofeedback, which is a form of biofeedback, which technically works like an EEG. So it's like brainwave based. There is not a lot of research on it, and it does usually cost quite a lot of money to do it because the equipment for it costs a lot of money for the people that do offer it. But it is something that is currently being researched in correlation to ADHD, because obviously our brains are a little bit different, and this is supposed to help us focus better, like train ourselves to focus better. I would look into it, but look into it knowing that there's not a lot of research on it, and it might be like not super helpful. So it's like more of a treatment to opt into if you truly have tried everything else. Then the next treatment option is obviously a low dose of a medication, so anti-anxiety medication in this case. There's no shame in taking medications until you found the therapy type for you or for the rest of your life if it keeps you alive for longer, because people like to not talk about this, but anxiety has a really high tendency to bring out depression and even suicidality. So yeah, for some people, taking anti-anxiety medication for the rest of their life keeps them alive for longer, and there's no shame in that. So taking like a low dose or just generally a dose of medication is totally valid, and you should try that if a lot of other things haven't worked yet. I always recommend trying talk therapy first and maybe even a somatic therapy, but if none of those work, try anxiety medication. Obviously no benzos. Please don't take benzos if you don't absolutely need that, because that's a hellish treatment to get off of again. Do not do that. I don't want to say they're hell. I have taken benzos for like an exam phase that almost took me out with anxiety, but they're not for long-term use. They are for like small phases in life or like an event here or there when you really get out of your mind anxious, not for permanent treatment. If any psychiatrist wants to give you benzos long-term, run. Then the next one that I want to mention is breathwork with a practitioner. I mean, breathwork is in general like something you will be able to find on YouTube with guidance, guided breathwork is a thing. And a lot of people say that it is really beneficial to them because it regulates their nervous system. That makes a lot of sense. A lot of people do it as part of their morning routine because it regulates the nervous system. But obviously I don't recommend doing this if you have any pre-existing health conditions, even if it's like some unrelated health condition to like the lungs or the heart or anything. I mean, for all we know, breathwork done wrong can trigger migraines even. We don't know that. So like, yeah, be aware of that. Like, don't only try that in like either a controlled environment, sitting on a bed and ask your doctor if you have any conditions, if you're allowed to do breath work. And also obviously look into the different types of breathing, because there are different types and some are obviously safer to do than others. Like fast breathing types of breath work are like more unsafe for people with pre-existing conditions in my opinion. But yeah, like look into that. Then the next one is more of a casual mention, which would be plant medicine. This is currently still being researched. Most plant medicine isn't legal in most countries, but I do want to mention it because it would be ignorant to not mention it. I feel like microdosing has become a big topic over the last couple of years, and a lot of people say it is helpful to them, but at the end of the day, those are still drugs. And I do want to mention that most of the research on this has been done in conjunction with an integrative therapist that is specialized in integrating drug experiences, both in the microdosing trials and in like the big dose, like heroes dose trials. So, you know, if you have a pre-existing condition, which you do have if you have anxiety, any mental health condition, you know, it is not the safest thing to do without any doctor knowing about it and being able to like follow along with you. My point is, you don't know what drugs will do to your body, even if it's microdose drugs. And if it's macrodosed drugs, it's not just about set and setting. If you have a pre-existing mental health or general health condition, I don't recommend doing this right now. I would rather try a lot of the other treatments and see this as like a treatment for the future once it's better researched, if that makes sense. I would wait for research if I was you. It's basically what I'm saying. Yeah, I just want everyone to like be aware of what they get into if they do stuff like this, especially knowing that it's illegal in most places. It's really like a last resort kind of treatment, if you get what I'm saying. Same way with some of the other things that I mentioned as like, oh, this is like a second or even third line treatment. The next one that I wanted to mention is eating an anti-inflammatory diet, which obviously don't do that in a way where it gives you an eating disorder because you're being too restrictive, but obviously some anxiety comes from inflammations in the body that a normal blood test maybe didn't find. So like trying to eat less inflammatory for a while might help you figure out if your anxiety might be body-based and not like mind or nervous system-based. Like that is something you can try to at least rule it out. I just quickly wanted to mention this. There is anti-inflammatory diets for different illnesses and different levels of restrictiveness. I don't think you should do the most restrictive diet unless you know you have like another like inflammatory disease like arthritis, for example. And then I quickly want to mention yoga as well. Restorative yoga or yin yoga, I don't know if it's always seen interchangeably, but restorative yoga has been researched to help with PTSD, which PTSD is a form of anxiety. So try restorative yoga at home with a practitioner. I mean, it is a little bit easier to find a yoga teacher nowadays, but I also urge you to look into yoga as like the actual cultural practice that it is, because the Western world has kind of bastardized yoga. Be mindful of that and learn about the actual culture behind yoga if you get into it. I feel like that even helps even more with anxiety, because you will learn deeper about the actual yogic lifestyle, the mindset, all that. It might help your nervous system and your mind quite a lot. But yeah, that's a quick one to mention. And then the last bigger one that I want to mention is TMS, which is transcranial magnetic stimulation, which usually this is used for people with neurological diseases like MS or Parkinson's disease, people that had a stroke, stuff like that. This one is actually one where I recommend looking into the Wikipedia article because it's quite well explained on there, I think. It has been researched to help. We need research to be backed up by more research, obviously, but it has been shown that it has helped people with depression and with PTSD. So that is another one of those last resort treatments of like, yeah, you could try that out. It's just really hard to find a place that offers it. And if you find one, it's usually pretty expensive because the equipment is not cheap to upkeep. And finding trials also is really hard. So this is overall a therapy that's pretty difficult to get into. So this is one of those, yeah, if you try first and second line treatments and you have like an actual treatment resistant anxiety disorder, that's when you would want to look into this kind of stuff. Same with like drug treatments and stuff like that. And then, yeah, other than all the things I just mentioned, obviously keep your vitamins in check. If you have anxiety disorder, I feel like you should regularly, every 6 to 12 months, get like some of your vitamin levels checked. Obviously you can't check for every vitamin. That's, first of all, not always possible for all vitamins, and second of all, this stuff costs money. Blood panels cost money if they're about like vitamins. Then I recommend you to try CBD. It works for some people, not for others. The research is inconclusive, but some people say it helps them. Then, oh my god, it started raining. Then I recommend trying massage therapy. Just like go and get massages, because the physical touch can help with your nervous system, and it's proven to like exude certain neurotransmitters that might help you. Same thing with, not same thing with Reiki. Reiki is also more on the woo-woo side. There's not really any research on it, but some people say because of their vulnerable, intimate interaction between them and another person, in person, obviously, not virtual, that helps them, because they're like in person with another person. Just, sometimes having another person has enough psychological effect on people, and we can't disregard the placebo effect. I'm not gonna lie, that is also pretty strong. Yeah, like, the typical, like, things. I don't have to repeat the typical things you will hear from people about panic attacks and anxiety disorder and how to help it, because that's what all the other channels on YouTube are about that do mental health stuff. My channel is full of videos, or I plan to fill it with videos that are like the basic stuff that you already found everywhere. Like the 5 things that help during a panic attack that you definitely didn't try already 10,000 times and it didn't help. You know what I'm saying. That's not what I'm trying to do with this channel, which is why I highly recommend subscribing, because I try making mental health videos for topics that haven't been covered, or they have been covered really like shallow. Obviously, you can't cover everything super deeply if you are not a certified psychotherapist yourself, but there's a lot of things that should already be covered in here, and they're not. I highly recommend checking out, obviously, other channels on here on YouTube when it comes to anxiety. I do think Therapy in a Nutshell has some really helpful videos about anxiety. You will be able to filter that yourself, because some of the tips are the basic ones where everyone is like, yeah, bitch, I tried that. But she also has a couple really like unique ones. I highly recommend watching. Like, she has an entire playlist for anxiety. I recommend watching that, because there's some good stuff in there. Yeah. What else? Is there anything else? There's always more. There's probably therapy types I forgot. You can add therapy types that are supposed to help with anxiety in the comment section if you want, because I know there's more. I know there's more. During the years, I've seen so many treatment options. There's no way I could fill an entire video with literally every one of them, but I hope you learned about 1 or 2 new ones in this one, because I know I was shocked every single time I found a new therapy type where I was like, wait, this is an entire fucking different thing. So yeah, I highly recommend sharing the stuff that you know in the comment section. I will not be able to give like unique input on your situation, so maybe not those kind of comments, because like I said, I'm in training to be a social worker, but I'm in a country where social workers aren't automatically therapists or able to become therapists, so I cannot give you very individual tips on your situation. And it's also like, yeah, secondary trauma is a thing. I don't really like hearing your trauma. That sounds offensive. Secondary trauma is a thing. I already work with a lot of trauma in my nonprofit work, so secondary trauma. I should probably make a video about secondary trauma and how that doesn't just show up in hospitals and stuff like that, but I'm yapping. I'm glad you watched till the end of this really long video. I think it's at least an hour long, or around an hour long. So thank you for listening to me yap for this long, because I know I can go on a little bit of a tangent every now and then, because, well, I have ADHD, so I'm glad I stayed pretty on theme for the entire video. But yeah, I hope I could help you in this video, and yeah, like, comment, subscribe, the typical, you know what I'm saying. Check out my last video about tidying when life sucks, because I've been there, and Let me know what specific stuff you would want to see videos about that you can't find anything on YouTube, because there's a lot of mental health things where nobody made a video about it yet. I'm always here for those. Obviously I can't cover everything, but I'm here to make a couple survival guides, if you will. So yeah, I hope I see you around. Bye!